Over 300 stakeholders in the local medical field, including doctors and nurses, converged at the Biltmore Plaza for a three-day event that started on Wednesday. The annual medical congress, organized by the Belize Medical and Dental Association, seeks to bring these professionals up to date with what's happening in the medical field, from changes in best practices to treatment options. This year, the congress is focused on emergency care.
This is the 38th annual Congress. This year focuses on emergency medicine. Our theme is a multidisciplinary approach to emergency medicine. We are catering for doctors, nurses, allied health. We cover all specialties, geriatrics, pediatrics, general medicine.
Emergency care is an important aspect when practicing medicine because what happens in the first 30 minutes of an emergency can literally determine life or death. The Ministry of Health is partnering with the BMDA as this serves as a continuous education process for health professionals.
With the Belize Medical and Dental Association, we have different goals and roles in the medical field, but one of our most important is continuing of medical education. We have different sessions throughout the year, but the Congress is a major one.
We have national and international persons who are going to be giving different presentations throughout the course of today and tomorrow. What we try to do is ensure that our staff participates in as much as I can without leaving the public health services unattended. So we try to rotate and ensure that we have active participation, because what this does is it counts as continuous medical education, which is a requirement for an annual license to be given.
According to the Director of Health Services, Dr. Marvin Manzanero, the ministry is in the process of retaining an emergency physician for the National Referral Hospital. That additional human resource, along with the ongoing training for triage nurses and frontline personnel, will allow for the Carl Hushner Memorial Hospital to better be able to address critical emergency care.
We are doing, in partnership with the university out of the US, what we call a basic emergency course using the WHO platform. We have trained people across the country, and so training is duplicated at each local facility. That has been happening all this year. That's one. Two, we are trying to get a cohort of doctors at Carl Hushner to be accredited by a university in the US in emergency care. And I believe later on this year we're going to have our first emergency physician, because that is a specialty of medicine. Eventually, I think we want to ensure that all frontline staff has some level of exposure to emergency care, because the triage and the initial 20-30 minutes in any given situation is what can dictate the eventual outcome.
Duane, Moody for News 5.